Hello, I'm Donna Meltzer. I am the CEO of the National Association of Councils on Developmental Disabilities. And today I want to talk to you a little bit about what our National Association has been doing around COVID-19 and solving some of these really big problems and issues that are impacting millions of people, not just here in America, but around the world. But our state councils are, of course, most concerned with helping and supporting the individuals who live in their own state or territory of the US, and making sure that we are doing everything we can to keep people safe and healthy, and able to really get through this. It's a really difficult time. So just to make sure that you as the viewer of this know a little bit about DD councils. There's one in every state and territory of the US, so there's a total of 56 councils, and the council body itself is appointed by the governor of the state or territory. And the role of the council is to really support people, to look across their landscape and to know what are the needs of people who have intellectual and or developmental disabilities, and we fill in those gaps. We look to help improve the system and make things work better for people, whether it's around getting the best healthcare or transportation or housing or education or whatever it might be that makes your life work. And so we work across all of those things. And our councils work a lot with state government and with the state legislature around policy and really creating change. And so that really has put us in a very perfect role for stepping up right now during this pandemic. And I want to talk to you briefly just about 4 different areas where we've been doing the most work. And this is all based on what we have heard from individuals who live with IDD, who have that lived experience, and from our self-advocates, our family members, professionals, direct support professionals, and so many others that are really all out there trying to make this world a better place. So the first really is around communications. One of the first things that we figured out at the very beginning of this pandemic, way back in March, was that we needed really solid information in plain language that everybody could understand about what does this mean? What is this pandemic? What do I need to do? What do I need to know? How do I keep myself safe? What do I need to know about staying home, or can I go to a job? Do I stay out in the community? Do I hunker down? Or how do I help my loved one? And how do I know what I need to know? So a lot of our state councils began developing great materials. We at the national organization worked with the CDC to provide a lot of plain language or easy read materials to help people understand how serious this virus is and what you need to know. And a lot of our councils also understand, and they know that within their state or territory, there are multiple languages that are spoken. So many of them not only created some of these materials and shared them across the states, but developed them into multiple languages and toolkits to really make sure that everybody has the best information possible. So that's really where we started. And we continue to this day to do that because there's constantly new information about what is the latest that you need to know right now, where we've been focused on flu vaccine and making sure people with IDD know about the importance of getting a flu vaccine. And now we're moving into the COVID vaccine and making sure people understand what it is, how safe is it? What do you need to know? How is it going to roll out when we get to that point, and hopefully not too much longer. So communications is a really big piece of what we've been working on. A second issue that really came to our attention was about how do we keep people connected during this time? When all of us are you see I'm here in my own living room. Everybody had to leave their offices or maybe leave the programs that they're in, maybe, day programs or, moving it back home with mom and dad or whatever it might be. How do we keep people together and how do we get them that wonderful communication information that we've been developing? So one of the things that we really understood early on was that not everybody has access to all the technology that's out there in our world. Some of us are very fortunate and we have computers and we have Zoom or Teams or whatever it is that we're connecting on digitally. But not everybody has that. So a lot of councils decided to really jump in and work on solving this problem. So a couple of states really took big initiative to purchase or work with other entities in their state or territory to get, whether it was cell phones or it was iPads, or to pay for the Wi-Fi services, or to pay for the training piece of how to use the technology. So, the more we can keep people together and using technology, the better off we all are. So our councils have been really focused on that. States like Maine and Kansas and so many others just really jumped in terms of purchasing the technology. What we've realized is it's really a three-pronged approach. It's the hardware itself, the technology, it's the Wi-Fi and making sure that you have access to it and can pay for it, and then it's the training around how to use it effectively. Also at our national association, we set up a discussion series. We have a monthly call for self-advocates, run by self-advocates, also as a way of using that technology to alleviate isolation and feeling alone or afraid or just needing to see people. So we're providing ways to come together and really talk a lot with each other about issues and things that we all have in common. We had a great conversation around voting. We had a great conversation around youth advocacy and leadership. We had another great one around mental health and isolation during COVID. So we're keeping these sessions going and really working hard to keep people as connected as possible. The third area was really, and kind of still is, but it's around PPE, personal protective equipment. At the very beginning of this pandemic, that was a really huge issue, making sure that if you're an individual who was living at home and needed your DSP or PCA to come in and support you, you needed to have that equipment, you needed that person to have that equipment, because often they were out in the community and seeing multiple clients across the day. You can't have somebody coming into your house without a fresh, clean mask and gloves and whatever it may be, particularly if your PCA or DSP is providing medical care for you. You want to make sure that they're taking all precautions. So we worked really hard trying to get hold of PPE, distributed. A lot of councils led the way in that. There was a beautiful story in Massachusetts that actually made the network news on one of the channels in Massachusetts, where it came to the attention of the DD Council that there was a young lady who was living at home with her parents. She had multiple medical conditions, very serious conditions, and the family had no access to PPE. Her DSP could not come every day, and her health was quickly deteriorating. So the Massachusetts DD Council brought this to the attention of a local news source. They did a story on it. The story was seen by a student group at Harvard University that pulled together a group that really wanted to get hold of PPE and distribute it. So they supported this family, but they did this really big project and they collected thousands of pieces of PPE and worked with the council to distribute it to families across the state. So what a great way to leverage one family's story and make it apply to so many. And other states did very similar things. State of California also comes to mind. They harnessed, got hold of, by working through the governor's office, just millions of pieces of PPE. And utilize their big state system of regional centers across the whole state to work to distribute it. And they brought in lots of local partners to get that done. So we continue to work to make everybody safe in their home, or if they have to access, being out in the community, that they could do so safely and feel good about being able to get the support that they need and keep everybody well. And then the fourth piece that we've really been working on is, I mentioned that the state councils work within state government. They're very connected to state government. And they were able to really work with a lot of, the DD agencies to really look at the Medicaid waivers. over many years, councils have worked in partnership with their DD state agency to really look at what happens in emergencies, and to know how do we step in when we really need to provide some more support, whether it's around getting that technology to somebody, getting the PPE to somebody, really looking differently at perhaps the Medicaid waiver plan that they're on to see where can we embed some changes that will help people to be safer and stay connected, get telehealth, better access to their medical care, their mental health care. And so councils really did a lot of work. We formed a work group very quickly. We got to CMS, we provided a letter, we outlined a lot of the ways that we thought that we could make some changes through what's called the Appendix K waivers, which are those waivers that can really come into play during an emergency. And we've seen such tremendous success from this and really have been working very closely with the Center for Medicare and Medicaid agencies, CMS, at the federal level, but to really help this play out across the states. At this point, back in the summer, we thought we were going to be unwinding some of these emergency protocols when we thought this pandemic was going away rather quickly. When we learned it's not, here we are almost 6 months later, and we're perhaps at an even worse point. We continue to work with CMS and with the state DD agencies to keep all of these protocols in place and to look further into the future at what are some of these things that we think should stay. There are a lot of lessons to be learned out of this pandemic. Right now, we're still all trying to survive, right? But we're also looking ahead. What are we going to change for the future so that we always do things better? So we are making those recommendations to CMS at the federal level and working through the states to look at what is going to make life better, healthier, and safer forever for people with IDD and their families and those who provide care. So we have a whole list of recommendations that we are presenting and putting forward, and we'll really continue to work on to keep people safe and connected. We live in a new world. And I'm a person, I always like to say that I'm a glasses half full kind of girl, and to look at what are those silver linings that can come out of this very dark cloud that we're in right now. I think some of these changes for better healthcare, for staying connected digitally, making sure that people have access to cell phones and other pieces of technology and can really connect, are some of those ways that we will forever be changed and grow and learn from all of that. I think some really big conversations are now starting to happen as we look at redesign, thinking about people with IDD. Where will they spend their days if they're not in employment situations in the future? Can we return to day programs, or do we need a whole new kind of effort around meaningful employment and meaningful day? Where will people want to live? We learned some very scary things from this pandemic about how congregate settings can be very unsafe. That is something that has been very problematic because we see how a virus can just spread like wildfire. How do we prevent that in the future? How do we look at where people live, making sure that people are still connected, living where they choose to live, being with friends, being with family, being in community, but also making sure that they're safe. So I see this kind of next period of time as we're still in crisis, but starting to look a few steps down the line and to think about where do we need to go? Where do we want to be next? And in DD Council world, we value lots of opinions and thoughts and ideas. We are formulating many of them and starting to work with our federal partners at the Administration for Community Living and CDC and many other organizations to really look at what's going to be next. Where will our world go? So we have a lot of work on our plate. We welcome anyone and everyone to join us in what we need to do, working with the Hill, working with our federal government, our state governments, and through our DD councils. And we want to just keep working for a better tomorrow.